Hello, and welcome to this presentation on CTN 152, Eligibility and Randomization. Once a participant has enrolled into the screening segment of the study, the participant must either fail the screening process, or if the participant meets all eligibility criteria, enroll into the randomization segment of the study. Whether the participant is eligible or ineligible for enrollment into the randomization phase, all participants who enroll into the screening segment of the study must have a completed ENRC form to indicate whether eligibility criteria were met, were not met, or are unknown. The information for the ENRC comes from several different sources. This chart shows which assessments will inform the population of each criterion on the ENRC form for the various inclusion criteria. As a refresher, here are our inclusion criteria. 18 or older, meets criteria for moderate to severe opioid use disorder, is within 7 to 80 days of initiating BUP in this current treatment episode, and is taking at least 8 milligrams per day of generic butanaloxone or the equivalent, is willing to randomize and comply with study procedures, understands the study, has provided written informed consent in English, and either is not of childbearing potential or is not pregnant, not breastfeeding, and willing to use effective contraception. All of these must be answered yes in order to be eligible. Most of the inclusion criteria will be determined through assessments performed by the RA or RC, although eligibility related to pregnancy, breastfeeding, and birth control will be determined through medical assessments. Depending upon setup at your site, the RA or RC may perform the urine pregnancy test and provide results to the medical clinician. However, only a study medical clinician may administer the pregnancy and birth control assessment. Now let's look at the exclusion criteria, which begin with criterion number 7 in our inclusion-exclusion criteria list. Participants are ineligible if they have type 1 or type 2 diabetes or an A1C in the diabetic range. They are also ineligible if their A1C is too low. They must have a BMI of at least 23, which is in the healthy weight or normal category, so anything less than that will exclude them. Any major cardiovascular conditions within the past 90 days will exclude a participant, as will significant digestive or gastrointestinal disease. Please note, for gastroesophageal reflux disease, or GERD, this disorder must have been diagnosed by a physician who has prescribed medication for it. Simply taking over-the-counter medications for occasional stomach acid does not qualify as an exclusion here. If the person has a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, they will be excluded as well. To assist with blinding, we want to exclude anyone who has ever taken tirzepatide or who has taken any other GLP-1 within the past 6 months. If the person has a known history of allergies or hypersensitivities to GLP-1s, they will be excluded due to safety concerns. Persons with significant kidney impairment will be excluded. Also, anyone currently using medications that can lower glucose or currently using systemic steroids will be excluded. Persons with a history of suicide attempts in the past year or who have current significant suicidal ideation will be excluded, as will people with any other psychiatric or medical condition that might make treatment unsafe or would make compliance difficult. Our last criterion deals with persons who have active prisoner status at the time of screening and baseline, or who have other psychosocial issues that have a pretty good chance of preventing full participation in the study. All exclusion must be entered no in order for the participant to be considered eligible. Most of the exclusion criteria will be determined through medical assessments. As a reminder, both blinded and unblinded medical clinicians can perform these assessments prior to randomization. The RA or RC will perform the PRISM, which will help with the eligibility questions around suicide and other psychiatric issues, as well as the dropout risk assessment, which will be the source for determining that final criterion. As a reminder, no matter what appears in the ENRC, it is up to the medical clinician to make the final determination of eligibility just prior to randomization. Now let's see what you've learned about eligibility. Here's Roy. Roy is a 45-year-old cisgender male with moderate OUD and obesity. He was treated with buprenorphine for 5 years, but stopped 6 months ago. Following a relapse, he's re-entering treatment. He took his first dose of buprenorphine for this treatment episode 15 days ago. He has no significant health or psychiatric problems currently, but he did attempt suicide about 10 months ago after his wife filed for divorce. He has never taken any GLP-1 before. He's curious if it can help with weight as well as with OUD symptoms. Do you think that Roy is eligible or ineligible? Unfortunately, Roy is not eligible. And the reason that he's not eligible is because he has a suicide attempt within the past 12 months. Now let's look at another screener. This one is Suzette, and here's her info. She's a 25-year-old cisgender female with moderate OUD. In 2022, she had a mastectomy and a total hysterectomy due to breast and ovarian cancers, and good for her, she's been in remission over 2 years. She used to be much heavier, but she lost weight using Ozempic until about a year ago, and now she's down to a BMI of only 25. She did have some mild depression after her husband left back in 2021, but after some counseling, she is not experiencing that anymore. Other than her cancer, she's never really been sick. Now, she does have an upcoming court appearance to work out some changes to the custody agreement with her ex-husband. And this is her first time in treatment with buprenorphine. She was on Vivitrol about 2 years after her surgeries, but it never really helped with cravings. She got her first shot of Brixadi 3 weeks ago. Is Suzette eligible? Good news! Yes, Suzette is eligible. Once the participant has been deemed eligible and they agree to move forward, the next step is to perform the randomization procedure. Upon confirming that the participant is eligible, the study randomization ECRF, the ENRC, must be completed in eClinical to document that the participant meets all criteria. We will go over this process during the eClinical demonstration. Submission of the study randomization ECRF in eClinical will formally randomize the participant in eClinical. Upon the system randomizing the participant, you will receive a confirmation screen that confirms enrollment into the study is completed and will provide the participant's treatment code. This code links to an Excel file that will be provided to the unblinded staff at your site and will inform them of the participant's treatment assignment. Upon randomization, the RA or RC will provide the participant ID and treatment code to the unblinded staff at your site. The unblinded staff will maintain the spreadsheet that serves as the link between the participant ID and their treatment assignment. Each site will have their own spreadsheet that links the participant's treatment code to their treatment assignment. The spreadsheet will have the first 3 columns locked. Only the participant ID column will be available for modification. The unblinded site staff will be responsible for maintaining this document and storing it in a secure location. Immediately following site endorsement, the DSC unblinded statistician will provide the password-protected spreadsheet to the unblinded staff members. Additionally, if at any time during the study, unblinded staff have questions about the treatment assignment or administration of the medication, they should reach out to the unblinded email alias and should not include any blinded staff, the lead node, or blinded MS staff. Now let's take a look at what happens post-randomization. Once randomization has occurred, the visit turns into the week 1 visit, designated as V01. First on the agenda is the completion of the dose increase form, as well as the administration of the study medication, both of which have been discussed in detail in other modules. We will then get another weight, and the participant will complete 2 craving scales in ePro. The next task is to assign the study cell phone and permanent Fitbit to the participant. Let's talk a little bit more about that. Participants who randomize will be issued a study cell phone to be used to keep in touch with them throughout the study. Once they have completed study activities or they have terminated early, they will keep the cell phone, but the wireless plan will be discontinued at that time. Begin by removing the cell phone from stock and plugging it in to begin charging. You will need it to be active in order to complete both the phone and the Fitbit setup. Document this phone on the cell phone log. Then show the box and contents to the participant and document their receipt on the equipment receipt form that was begun when issuing the screening Fitbit. Inform the participant that the phone is theirs to keep and that they will receive a free wireless plan as long as they are in the study, but that wireless plan will end once they are no longer participating. The next step is to unsuspend the phone on the Verizon online portal. Turn on the phone to obtain the phone number from the display screen. Please note that once a phone has been turned on, it is automatically activated and we will begin being billed for it. So please do not turn on a phone until after randomization has occurred and you are ready to give it to the participant. Next step is to log into the Verizon portal at the link shown and unsuspend that specific phone number. We'll go through this process in the next few slides. Please keep in mind these screenshots are from the OVN's business portal. Your individual portals may look slightly different. Once logged into the portal, navigate to Manage Lines and Devices. Scroll down to Plans or Manage Accounts and click the link. That will take you to a page that asks you what you want to do. From the drop-down, select Resume Service. Select the phone number that you want to unsuspend. This slide shows you what options are available for the number you have selected. Although the options on screen are different from what you will see, you should have 3 options available to you. 1, on the same device and SIM card. 2, reconnect a different device. Or 3, reconnect a different SIM card. Make sure you select the first option, on the same device and SIM card. Then, click Reconnect Now or Resume Service, however it appears on your screen. You should get a confirmation similar to the green bar in this picture. Click to confirm you are reconnecting the service. You should then get a page with a button to submit. Click that now to complete the process. You then will see a page confirming that the order has been placed and the status of the order. Now when you refresh the page, or the next time you log in, you will see that the device's plan is now active. You can also perform these same steps using the My Verizon app. Sites will typically issue a new Fitbit following randomization, but may reissue the same one from screening if that's preferred. Although issuing the participant's personal Fitbit is similar to issuing the screening Fitbit, setting it up is slightly different. First, you are not going to attach this Fitbit to the general study phone. Instead, you are going to attach it to the cell phone you just gave them. These next few slides show us how to do that. The phones being distributed to participants are Androids, so you will need a Gmail account attached to the phone. This will serve as the Gmail for both the phone and the Fitbit. While you can use the participant's personal Gmail account, you may want to consider setting up a special one just for this purpose. One suggested approach is to set up an account named CTN152 plus the site code plus the participant study ID last 4 at gmail.com. The phone will tell you the account is added. Just select Finish to complete this portion of your setup. Now open the Google Play Store. On Google Play, search for Fitbit/Google Health. Select the Google Health Fitbit by Google LLC, ignoring the paid advertisements or the premium version. While Fitbit used to have its own app, Fitbit now stores its data on Google Health app. To begin, click on the bar that says Sign in with Google. Then sign in with the participant's Gmail address and password. These should already be saved in the phone. Let's take a walk through some of the features of the new Google Health app. As noted earlier, Google Health uses your participant's Gmail account. Allow Google Health to send notifications and allow access to location services, locations permissions, and background location permissions. Then add demographics information. Now add the device to the app. Select Connect a Pixel or Fitbit and select the Charge 6 device. Once the account is set up, the RA or RC will assist the participant in syncing their Fitbit to the app. To sync, slide your thumb or finger down on the screen to activate syncing of Fitbit and phone. Release to sync data. Instruct the participant to sync the Fitbit to the phone on a regular basis. Daily syncing is ideal, but syncing should occur no less than once every 3 days. Explain to the participant that they should not change the password or username until after they have completed the study. This will allow the study staff to access sleep data in the event that the participant misses a future visit. Provide the participant with a copy of their completed study equipment receipt. Now let's move on to reimbursement. Randomized participants will receive a payment of $50 following the end of Visit 01. If they brought the Fitbit for data download, they receive an additional $10. The IRB-approved receipt log must be utilized to document the participant's receipt of payment for study visit completion and Fitbit data. The final step is documentation. Ensure all paper assessments are entered into eClinical, then complete the visit documentation form for Visit 01. The randomization checklist and progress note is combined to incorporate baseline, randomization, and the post-randomization Visit 1 activities. Complete that, file away all your source documentation, then celebrate. If you have any questions, please feel free to reach out to the lead node. Specific questions about the Android or the Fitbit can be directed to Lindsay Bybee with the CC to Frankie. Thanks for joining this training presentation.